Recording. All right. So, hello, Zach. How are you doing today?
Oh, having a pretty good day.
All right. So, this is our follow up going over the blood work I had done when you'd come in on the 31st, where you had issues of worsening and depressing mood state, erectile dysfunction, loss of sex drive, and overall extreme fatigue. I'm not forgetting anything.
Don't believe so.
Okay. So, with regards to your blood work, the first thing is you had a reduced white blood cell and hemoglobin level, and then your total cholesterol level was very high at 185, and then finally, your free test was 30, which is extremely low, and your total test level was 190. As a result of this, I've scheduled an endocrinologist appointment so he can further go into explaining and looking into the hormone aspect of it with your testosterone level. And that could be affecting all the other things I had just discussed, such as your hemoglobin levels, your white blood cell, if your testosterone's thrown off, as well as with the cholesterol. Excuse me, your testosterone and then the cholesterol level is extremely high. We can run into issues with that. So, what I would like to do is after that initial endocrinologist appointment, I'll schedule follow up appointments based on his guidelines and what his hormone treatment plan will be. But how it looks now is every 2 weeks, we'll meet to go over changes I'd like you to make and record. I won't ask you to start because next week you have your endocrinologist appointment. But following that, I'd like to make some dietary and exercise changes and reduce your weight. That should hopefully help to change your overall cholesterol and put it in a better state. So, the first thing I'd like to discuss with you is in terms of dietary recommendations. I'd like you to record just for the next few days until your endocrinologist appointment to the best of your ability what you eat. If it's something as simple that I've recommended to other patients is take a photo with your phone, set a caption, was this date, write it down when you get home. So for morning breakfast, I had a chicken sandwich or an egg and cheese McMuffin. For lunch, I had a chicken sandwich, excuse me. And then for dinner, whatever you had. And try to include any snacks. I'm just looking for a general outline so I can see your dietary habits. If you're eating out 3 times a day from fast food, that not optimal, but I'd prefer you not lie about this.
Right.
And then after the endocrinologist appointment, one thing I would like to start is an exercise routine of walking 15 to 30 minutes a day, 3 times a week. We'll just start there. I'd like to build up into more cardiovascular activities for longer periods, as well as some weight training potentially, depending on your experience and comfort level and interest regarding that. So, the final thing I want to talk about, well, excuse me, do you have any questions or any concerns? Would you like me to reiterate on anything that I may have poorly explained?
No, so we'll have another appointment with an expert in a week. And until then, you just like me to record what I'm eating and when I'm eating it.
Yes,
Sounds good.
on the day what you eat. So after your endocrinologist appointment, I will be in touch with him to go over the hormone level, excuse me, the hormone treatment options that he'll likely recommend. And then based off that, I will be your main, through the telehealth, I'll be your main source of information, the network for everything you need. You can send it to me, my staff, with any questions, comments, concerns. I'll be in touch with him constantly, as well as the local nursing staff from the local hospital in your rural area. Depending on what he recommends for hormone treatment, we'll get blood work done once a month, and then we will go over that as well. And that'll all be virtual. The only thing you'll have to do in person is see the endocrinologist appointment for next week, or excuse me, the 29th. And then when the blood work needs to be drawn, you'll have to go to the local rural hospital that's about 15 minutes away, if I remember you saying that.
Hmm.
And the local nursing staff will draw your blood, take care of everything. You'll get the results both in letter form from me, as well as they'll be immediately available through the patient portal. My staff and I will handle all scheduling for booking your upcoming appointments, your initial 2 week after the endocrinologist, when we'd like another blood work, and we'll work around your work schedule and the drive you have to make, so it won't be an issue for you. Do you have any basic questions or follow-ups, or maybe some concerns with, we kind of touched on a lot, but this is a follow-up appointment, and
Sure. So you mentioned, I think our next meeting is going to be 2 weeks after the endocrinologist's exam.
for that one, that is the tentative plan, but depending on what he makes, and I'll have my staff schedule send you an appointment that works within your schedule that we had talked about before. Outside of that, it wouldn't be any sooner. So roughly that 2 week range after the endocrinologist, unless something drastic changes, in which case I'd notify you as soon as possible.
Okay, sounds good.
All right. If you have no other questions, that's everything I wanted to go over with you. I just wanted to recap the blood work, the cholesterol, the testosterone, and what to expect from the endocrinologist appointment. So, nothing further.
Nope, nothing further.
All right. Have a great rest of the day.
You too. Goodbye.